Chapter 2. Our Right to Health. What is it like to live with an invisible disability, and what would you like people to know about it? Sarah, Andrea and Kate are sitting at the table.
A lot of invisible disabilities can be chronic illnesses and they don't often qualify for funding, and this can be really, really hard to navigate, particularly if you're undiagnosed or kind of fit in some different categories. It can be really, really expensive. They also have really long waiting lists, which often don't have a lot of support. So you can be waiting months and months and months for a service you may or may not need, and it's a really, really hard thing to navigate.
The other fun one, I think, with invisible conditions is that there is this sort of assumption that if you're looking okay on the surface, then everything must be going fine, you don't need any changes, you don't need support. And that isn't necessarily the case. And that can feel like that you're repeatedly having to disclose your condition and your support needs just to make sure you are getting the help that you're needing. There's invisible components to a lot of things, and then there also can be those visible moments that break through. And if something's showing up, particularly if you're out in public or something like that, you can get some quite personal questions about your health and your body that aren't really appropriate to just walk up to a total stranger and ask. So, if on a rare occasion I use a disabled parking spot, I've occasionally had somebody come up and ask what my right is to be there and what's wrong with me, and well, it must all be in my head, which is an interesting space to be in.
I had an appointment early in the year, and my support worker realised very early on that I was uncomfortable talking to people sometimes, and I can be a bit forgetful when I'm stressed and anxious. So she said to me, would I like to go on the appointment with you? I said yes. And she said, was there anything you'd like me to say on your behalf if you get stuck? So I told her what I needed, summary of what I needed to tell the doctor. And because I had her supporting me, I remembered everything, which is a great feeling.
What are some of the most unhelpful things health professionals have said to you?
One thing was said to me that was very, very unhelpful. I cannot read properly, and I went to see an optometrist who could not figure out why I couldn't read properly. When I told him, when he finally saw that I couldn't read because I had an acquired brain injury, he spoke to me like this. I was very insulted. I said, could you please lower your voice? He said, do you want me to lower my voice? I said, yes, please. I'm highly intelligent. I do not need you to speak to me like that.
When things are not working the way they were expected to, it's not helpful to be blamed for that. It's not your fault. It's not that you weren't trying hard enough or that you didn't want it to work. It's just not the right solution for you at this point in time.